Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about fractures. There are multiple fractures that happen in the foot and the ankle area, and we're going to focus really just on the forefoot area. So when you take the foot, you actually break it into the rear foot, which is the heel and the ankle joint area, the midfoot and the forefoot. We're really going to focus on the forefoot, which is the heads of the metatarsals and the phalanges, which are the toes. And the most common injuries are fractures to these toes. For some reason, we have a tendency to kick things on a regular basis. We're walking and we kick the door frame, we kick the bed frame, we kick a door that's partially opened, we kick rocks as we're sliding off of things and so forth. And although you can injure nails and so forth, you can also fracture the toes and fracture the digits there. So the question is, what do you do if you've got a fractured phalanx? And really the question is threefold. Number one, is it a stress fracture, just a little crack in the bone? Is it a through and through fracture that's in the place it's supposed to be? Or is it a displaced fracture? Because they're all treated differently. If you've got a displaced fracture, of course, it needs to be put back into place. And in most cases that may require numbing the area up and repositioning and so forth. It could require surgery in rare situations when it comes to toes, but it may require that depending on the type of fracture it is. If it's in good position, a lot of times you just say, okay, how do we keep it in that position? How do we protect it? And how do we kind of splint it or cast it so it doesn't get worse? Now, toes, putting a cast on a toe is not realistic in most cases. You can't really cast toes in 90% of the time. So what you're going to do is you're going to put it in a splint of some sort. The best way to splint it is to the toe next to it. We call it a buddy splint. You basically put tape between the toes, wrap them together, and so that they don't move. And what that does, that limits the motion across that phalanx, which allows it to hold it in position. And if it's a pretty significant injury, and it's one of the middle toes, for example, sometimes we'll do a splint where you tape 3 toes together. That's very rare. So as with all injuries, fractures are going to be treated the same way as many of the others. Rest, ice, compression, elevation. Right? Rest, ice, compression, elevation. Rest is to limit motion as much as you can, keep it from moving. Ice, of course, to decrease inflammation. Compression, wrapping it in some way to keep the swelling down. And elevation, again, to keep the swelling down. So what are some of the ways that you can protect the toes besides just buddy splitting them? You can actually put them in a boot or a post-op shoe, something that doesn't bend to protect the toes, and that's the most common. You can, as with any other fractures, there are multiple things you can do to speed up healing. The way that you eat, making sure that you have sufficient protein, sufficient nutrition will help in the healing. Making sure that you have the appropriate nutrients, including vitamin D, and calcium. Making sure that you take things that may help speed up the process. I mean, we have an MLS laser that speeds up bone healing, as well as Dr. Christopher's Bone and Tissue also heals bones more quickly. So these are all things that you can do. If you're saying, okay, I have a fracture, should I be seen? It is a good idea to get an x-ray and make sure it's not a big deal. And we'd love to see you. Or you can go somewhere else and get a fracture, but you want to make x-ray, but you want to make sure it's someone that reads it, that looks at x-rays on a regular basis, because stress fractures are commonly missed. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 365, I think. 365. Fractures of the digits, the toes, forefoot area, and what you should do for it. If you'd like additional information, reach out to us at utahfootdoc.com.